The keynote this morning is Reinventing Digital Transformation to Elevate Patient CX. What can pharma learn from other industries?
Cool.
Stage is yours.
All right. Good morning, everybody. How are you? All right, so my name is Robert Britting. I work at Teva Pharmaceuticals. I am a senior director there. And again, upfront disclaimer, and everything I say here is my words. It's not my organization's words. I think that's important to say. I have worked across a couple multinational companies, AstraZeneca, Novartis. I was at agency prior to that, so I've worked under every single commercial function from sales up to now executive management. And I work now with our digital innovation group, our marketing organization, and our transformation office. So all my experiences now are starting to try to help our business grow into and evolve into the business that we think it could be at Teva. So that's me on a professional note. But here today, my objective this morning is to, and I talked to Simon about this when I agreed to do this, was to kind of get us thinking a little bit different, a little bit beyond what we typically do in pharma. Because we know in this world that we're the most regulated industry on the planet. We can't breathe without somebody objecting to it. We can't spend money in certain ways. We have really great partners in regulatory and legal who are always trying to protect us. But we have to change our mindset, I think, in order for us to be successful. And today what I'm going to do is bring you through a couple of examples of how other companies outside of pharma think a little bit differently about customer experience, and maybe just get the juices flowing for the day today to think about maybe how can I challenge either my customer, if you're on the vendor side, or if you're on the marketing side, what can I do to start to challenge my internal stakeholders to think a little bit differently? Because we're doing this in some of the companies that I've worked for, and I've seen significant change. So, here, what's this? DNA, right? I think one of our biggest challenges is that we are such a traditional industry that we do the same thing every year because it's successful. And I think one of the problems that we have is that we are extremely successful as an industry because no matter what, people still need medicine. Every single person here has either worked on or knows a billion-dollar medicine. Only this many people, compared to this many people that work, have the opportunity to work on medicines or products that large. We're very lucky. And I think we're so lucky that we forget that there are maybe other opportunities that we could do things a little bit differently. Kind of like how, so I don't mean to offend any of the Philly people here, but I'm a Yankee fan. I'm a Yankee guy, right? All right? But a 96 Yankees, all the Yankees, early Yankees, Derek Jeter guy, that's my guy, right? They played small ball. They were able to bunt, they stole bases, they did all the stuff they should have done. They have lost that now, and they just swing for the fences, and they're not that good. It's obvious. So I think pharma is becoming like that. We're swinging for the fences instead of trying to do the little things that work. And I think what we really need to do is start to change our mental DNA as an industry. And it's hard to do depending on the level that you're at. Now I'm at the point now where I support the people who run the U.S. business, the European business. I see things a little bit differently now than I had in the past. When you're a stakeholder at the middle management level, it's hard to make change when the people above you keep pushing down when you come up with a new idea. So what I'm going to do today is maybe give you a couple just ideas and things that you may be able to use internally in your presentations. And Simon, by all means, you can pass this presentation out to everybody. I'm assuming you're going to make this available to everybody, Simon? Yeah, good, because I want you to be able to use it. Copy and paste it into your presentations. That's fine with me. That was the whole objective here, is to try to help create positive change. I'm not going to go through all of this, but this is the main slide for that you could use with a number of research done on the back end as to what actually changes a customer mindset. And it's really digital transformation. And we'll talk about a couple of different organizations and how they've done that and how they've become successful because of it. But if you look at it, you have customer experience, business models, operational efficiency, data analytics, all the stuff that we talk about. But as you go down, just like a marketing strategy, right? You need to have your vision, your strategy, and then your critical success factors. So many times we go from strategy down to tactics. That means nothing. That's just because the sales reps ask for it, we do it. It's pathetic. We shouldn't do that. We're hurting them. Right? So in the end, all these different items at the bottom here, you should be able to use and maybe even research yourself further based on the product or service you sell. Say, how can we do this a little bit differently? So you could use each of these as different slides and with presentations back at your own offices. And also today, I know typically we have 30-minute meetings, right, at work. Everything's 30 minutes or an hour meeting. I have a 30-minute presentation. My objective is to do 25 minutes. That's what we do with the people in anyone that works for me. We try to get meetings done early. There's no point in having meeting after meeting to talk about meetings. It's absurd. It drives me absolutely nuts. I also did in the presentation, what we could start to do is this is something, before I get into this piece, when you do a PowerPoint presentation, there's a morph feature. So if you know someone that's good at PowerPoint, learn from them. So as you morph your presentation, your story is told a lot better versus the slides turning over. So I tried to do that here, and I have a couple breaks that I'll call out to say, here's how you might want to start maybe changing the way that you communicate internally as well too. So now what drives the best-in-class patient experience? And we see this across all different companies, all different products from Humira down to Crestor, because I was at AstraZeneca, or Lipitor. What do? They gain substantial competitive advantage through digital transformation. And that's really the main thing. Even back in the 90s, companies that were able to communicate with patients online quicker than others were able to get more patients involved. That's a major, major thing. And even in the organization, I'm not going to speak directly about mine, but other organizations that I've worked for and good friends that work in the industry, the stakeholders that have to approve the things that we get through aren't always ready for it. So stakeholder management is actually more important than the idea that you have. Change must affect everyone and not just one person, essentially. That's the one problem that we have. If you have an idea, and that idea is to say, listen, we can move things forward at this company if we are to do this for this product with this group, but it only affects 2 out of 7 stakeholders involved, you lost. And more patients are getting hurt because they're not going on your medicine as they should be because we couldn't get the story through. It's all about stakeholder management. In the end, I think it's really a self-awareness exercise as to what could we do differently and what can we do better as individuals and leaders to actually get our point across. And I'll pop through these somewhat quickly, and there's going to be a lot of content in the other slides, but I'm showing you the morph feature so you can learn from that too. So Starbucks, we had Starbucks this morning. It's good. I watched a CNBC episode about 10 years ago where they showed the process for how they dealt with the beans in Starbucks, and they burned them the last minute and 30 seconds, and I stopped buying it at that point because I'm like, you know what, you're suckering me to make it seem like that it's a stronger coffee. I'm a Dunkin' Donuts guy, it's just a side note. But, or McDonald's, $1.50. All right, so learn. So, Starbucks, using AI technology enhanced customer satisfaction. I'm going to read off this here at high level. It's a well-known coffee chain, 32,000 stores, 80 countries. They introduced digital transformation in 2017. Think about it. COVID happened in 2020, and they were already at the forefront of this before it even happened. So they understood this. Now watch the morph slide. It makes the story fun. Now if you want to go through, now you can follow the story a little bit better. So initiative, they transform the rewards, they personalize the payments, the ordering system based on customer feedback. That's the front end that you see as a customer. But whatever you did on the front end, it was stored in the middle, and then the back end, if you see managing inventory and production, that responded to it. So whatever they produce on the front has to work on the back end. Now, how do we apply that as a means to a pharmaceutical marketing campaign? Whatever you do with your customers externally has to hit the internal groups in a way that they can move it forward. That's a big part. Now, additional technology, they personalize their product offerings, offer rewards based on customer preferences. That's the big thing about Starbucks. They care about what you think, about what you want. So the key to these guys is that it's for you, for me. This is like not the real Don Draper because he was not a good guy, but you know, this is the moment that he would say, Starbucks for me, right? That's what they want you to feel, right? And Starbucks is a holistic organization, so they're not channel specific, they're not tactic specific. It's a holistic experience when you go in there. There's a hilarious movie with Paul Rudd in it. And it wasn't Starbucks, but he said, I'll have a venti, please. And like, oh, you mean that? He's like, no, it's not the large, that's a 20. And he argued with them, but it was an experience that the people that associate themselves with it wanted to feel. It's personalized. They put your darn name on the cup. I mean, we are so insecure now to like say where we are and say anything because we're afraid people are going to think. They write your name right on the cup and yell it out loud. And people go there. They're engaged. They constantly engage you through their services. Right? So there's an opportunity there too. So think about this. And honestly, please use these slides. Even though it says I own them, do whatever you want. So learn Chick-fil-A. I love Chick-fil-A because my kids love the nuggets, and my kids are hilarious because they only eat the nuggets with the pickles. They have to eat a nugget with the pickles. Now I do it. It's fantastic if you want to try it. But Chick-fil-A. Chick-fil-A is an awesome company. It is it's one of the fastest growing, it's an A-plus food chain across the country. They closed on Sundays. Why? They use their cultural religious values to say, this is what we're going to do. Agree or disagree with whatever cultural religious aspect of it, you know where they stand. So there's no questioning where they're at. They go the extra mile. Have you all been to Chick-fil-A? If you haven't, they're like the nicest people on the planet, and they come from everywhere. Like, the training is awesome. Like, the people are so nice. They'll come out to the car, they'll help you out, they'll talk to the kids. It's like really cool. It's like the 80s, which I miss. You know? So again here, so the brand is committed to providing service, not common and quick service restaurant. Now you go to McDonald's, right? I bring my kids, I have 3 little boys, 8, 6, and 2, so I'm there all the time. When my wife's not around, of course, like daddy daycare, it's terrible. It's, everybody gets a Happy Meal. So we walk in there, and there's nobody at the front. I have to go order at this kiosk, and it takes 15 minutes. It's like McDonald's used to be 1 minute and 30 seconds, and that's what Ray Kroc and all the people that built that wanted you to do. Get in and get out and come back 100 times. Now I don't go in there. I only drive in. If the line's long, I don't go anymore, and I go Chick-fil-A. So there's there's opportunities there. So Chick-fil-A, they make everyone feel welcome. That's another piece. Now watch this. See my transition. Let me go back. See what happened? See how I went to this one? I'm just going to go back real quick one more time. See, this is interesting. You're like, oh, what's he going to say next? Very cool. Now I took the morph out of this. This is just a PowerPoint education. And it went to the next. Now you could care less what I'm saying because it wasn't interesting. It just copied and pasted that stuff on there, right? So that's just a lesson for the group. Chick-fil-A even allows its franchise operators to get creative. So think about that. How can you think that way about your physicians and your customers? How can you allow them to customize the conversation about your product with their patient? Instead of creating one thing because one rep in one big territory asked for it and send it out to everybody 6 months after they asked for it, which is not relevant anymore, create content that can be individualized, even though you control the actual content. Create something for them. That gives the rep something. I sold forever. Believe me, I'm telling you something. I'll admit this. For an entire year, I used 0 collateral. For a whole year. And I was number 2 in the country with Crestor. I said the right messages. I had the sales ad. I did the right stuff. I used the PI. I swear I did. But I didn't use any of the stuff they sent out because it was the same stuff. It's garbage. And it's 6 months late. Right? So here's the other thing. So their hospitality, they're uncommon, owners lead. It's a warm feeling. Really what I could have put there instead of warm is these guys, they're just not afraid to just transform everything around them. They're disruptors. And that's a big word, and I didn't want to use it because everyone's saying, oh, I'm a disruptor. Like, yeah, how so? Right? So, but they really are a disruptor in this market. The next one is FedEx. Now, this is a fun morph, too. Watch him drive. See, now he drives over. It makes it fun, right? So they take pride in connecting with people. When you think of FedEx, what do you think? They get there on time. You think of the Postal Service, what do you think? Half my mail's not there. Right? I mean, and that's a shame because I've had family members that worked at the Postal Service up in North Jersey for a long, long time. So these businesses are starting to take over. It's the second most trusted American company, and that's a ranking that they receive every year. They prioritize relevance over frequency, improving their satisfaction. That's important. They prioritize relevance. So they want to be relevant in your mind. When you say, I need to FedEx this, versus, oh, I need to mail it. And they're winning. It's like, hey, instead of getting a tissue, my grandma would say, hey, let me get a Kleenex. Right? Because that's the brand. She's asking for the brand. Best-in-class shipping, of course. They have to have a great supply chain. That is something also, too, that I'm not sure of all the people in the room, but if you're in the marketing world and you haven't gotten into the world of executive leadership where you're dealing with supply chain and all that, strongly suggest you sit down with those folks to learn their day-to-day job because a lot of that really can impact what you're doing out in the field. Your volume and your demand is huge. And the executive level marketing groups and the heads of different groups are talking more and more about marketers that talk about demand generation versus simply market share, because that's a sales rep way of looking at it. So start to change your mind a little bit and you'll make good networking contacts. And frankly, for you, if you're in marketing, you want to get to the next role as a side note, there's so many other places in the organization where you can actually learn how the business works. And the business is actually kind of fun to watch. So and the last thing here I think is really, really cool. They pledged to help 50 million people by their 50th anniversary, and they blasted it all over social media. That's something we need to be proud of. We need to blast what we do over social media as much as humanly possible. I know a lot of it comes with regulatory and legal considerations, but if you have the concept, bring those people in on early, because if you do, they'll be down for it. And if you could show them, again, the word demand generation, and you have the right people in the room, they will almost be forced to find a way to help you with a solution versus saying, no, stop. Okay? So the next thing here is, this is everywhere for everyone. This is the essence of who they are. They're connected, they're efficient, and they're a tradition. They're a tradition. We know FedEx, and we all want to use FedEx. Now, how can Pharma get here? These are just 3 examples, and I'm only going to go for another 5 minutes or so because your morning started, you're having coffee, probably have to use the restroom, probably had too much coffee, whatever it is. Give you a second. And I'm trying to run this like I do the meetings at work. Let's get through it, and let's have a conversation. If you have questions, we'll go through. But how can we as Pharma get to the point where these companies are? And frankly, There's a couple slides I'll go through, but we have to have the guts to have the conversation. But it's not what you say, it's how you say it to the right people. Because I've been in situations where I've seen executive management hear a great idea and just push it down, and that person gets pushed to the side because they're a little out there. That's a problem in my opinion. That's a major problem. Like, I can't stand that. It drives me nuts. And I'm trying to change it where I'm at, which is good. It's actually going in the right way. So this is a fun one. I didn't put KISS because to keep it simple, stupid, because then I just said it and I'll probably get in trouble. I don't want anyone to get mad. So it's the KISS principle. Keep it simple. And you'll see that go throughout here. So the things I think that I learned when I did the research on these companies and the 50 other that I looked at before I chose these guys, was that stakeholder management is huge. When you look at their management teams, you look at how their marketing organizations work. They work not in silos like we do in pharma. Every single person here, if you work in pharma, you know you work in a silo here or there. How do you break those silos? And that's working with the people next to you and being altruistic about it, right? Early and often. That's the key, early and often. The next part is business cases. If you can't measure it, don't do it. And I really mean that. Because companies now are starting to say, and as you can see, the economy is getting tighter. As much as you see inflation up 4%, it's actually up 22%. I work with my local township, and costs for things are about 26% up higher. So you can debate what the actual inflation rate is. So it's much harder for companies to organize. So my organization publicly stated, other organizations publicly stated about a year ago, said that they're planning for a recession. So all the financial decisions up and above marketing have been made based off of a potential recession. They're already operating in that way. So your business case, and I would look up on Google and go to maybe Harvard Business Review and other areas, how to do a proper business case. And I might even be able to send Simon some concepts of how to do that. Because what you need to do is, even if you can't measure it, there are qualitative metrics that you can put, like surveys or whatever it might be. Show that you're looking to measure what you're doing. Be more involved. The next is tactics fail when they're reactive. Insights rule. And I think the answer is, the big key is so many times marketers hear from sales, we need this, we need that. Or they come up with this great idea and say, hey, take this tactic and talk to your doctor about it. That's a problem. Because if it doesn't go towards your vision, your strategy, and it doesn't align with your critical success factors, which are your insights. Insights are not facts. Remember, it's how a human being thinks. How they think. It's not what they've done. It's how they think. The insights are everything. So if the insights can drive whatever you're doing, and you can prove that in a story to your internal group, that will help you dramatically. And the last part is, you like that? I thought that was cool when I flipped. The holistic mindset. That's the key. Make sure when you're having your conversations early and often, you're including your legal, your regulatory folks, and take them out to lunch. I mean, that's the thing. To me, that one thing I've learned in talking with those folks is, I said to them, I talked to a couple different companies, so what can I do, because I was in sales, what can I do to help you help us come to a solution versus a no? And they say, get us early off, get us in there early. I said, okay, that's an easy answer, right? That's almost like a regulatory answer. Get me in there early. Okay, great. But you're going to say no 90% of the time, so I'm not going to do it. What do I do? He said, get me in early and explain to me how your customers are thinking and how much the organization could potentially lose if we don't think of this a little bit deeper. That's where demand generation gets in part of. So it's your TRX side of the business, not your NRX side of the business. So if you're not familiar with that, get closer to your operations folks, your analytics folks, your supply chain folks, just to get to know them. And it might take 4 or 5, 6 months to get to know them, but getting to know how they think can help you drive your marketing plans. So that's it. My objective this morning was to say, in Pharma, we have an opportunity to do things a little bit differently. And I think as this group, I can see, and I'm going to make an assumption, that this is either the generation of leaders and the next generation of people that will be taking over different companies. Start to push people around you to think this way. Because as an industry, if we don't change, we're going to become regulated even more, and less patients will actually be helped. That's my personal strong opinion. So I really appreciate you guys having me here today, and thank you. How did I do with time? Perfect? Good. All right, thank you. Sure.
So really quick one.
Sure.
That was really cool. Thank you for that.
Yeah.
Love this pace. So you said the second most trusted brand. I have to ask, who's the most trusted brand?
Which one are we talking about? Sorry.
You said FedEx is the second most trusted brand in the world, I think.
So,
do you know who the first most?
For travel, there's one in Europe that's even more travel. I can't remember, the name is escaping me. It's a European company. That's
Okay,
used all throughout
I was
the
just
European
curious
Union.
because you said
That's why I
second.
used the U.S. one.
This is how my brain
Yeah,
works.
yeah, I gotcha. Yep,
Sorry.
yep. Yeah, it's a Euro something, Euro travel something, but that's what they use there. Yeah. What else? Anything else? It's okay. I won't take offense to it. No, it's all good. I just hope this got you guys thinking a little bit. It just and honestly, use these slides if you see them to be important or fit, and practice the morphing. I think it makes a huge difference. One thing of advice: I wouldn't use it if it's a vice president level or higher in a big pharma company. They will get turned off by it. Show them the numbers and show them how you're making the money. Anybody below that, you can play around a little bit. Yeah. 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 Yeah, so I think every single person in this room is probably creative enough to think of great ideas and say, we should be able to do this. Because you talk to anybody, hey, we should do that, hey, we should do that. Know your insights. I'll go back to that. That's the key. Know your insights. Know where your demand generation is coming from. Understand your market. Sit down with your forecasting team. That group of people, to me, typically are the nucleus for everything else that happens at the higher level and at the lower level, but only the top 20%, title-wise, know that. So sitting down with your forecasters, understand, hey, over the next 3 months, what's going to happen? 6 months, what do we have planned out for our AOP plans, or however you guys are looking at LRP plans over the next 2 years? What's this market looking like? Who's coming into the market? How much are they going to take from me? So when you're sitting down and you're having those conversations, you can understand your customer. Because then if you say, listen, a year from now, these 3 generics are going to come out, and this is how doctors think, and this is how patients think. Because now you're customer-centric. Customer used to mean consumer. That doesn't mean that anymore. It's anybody. It could be specialty pharmacy, it could be buy and bill institution, it could be anything. It could be government, whatever you work on. So knowing your insights and knowing where your market demand is coming from is literally everything. Your forecasters, the key there. I apologize I didn't mention them earlier, but they're huge. Your supply chain team, just get to know them. Even if it's the manager level person that is working on the day-to-day, get to know what they're doing and ask them to see the numbers specific for your product. Yeah. Okay.
But my question is, I'm in the business of measurement.
Yeah.
And you talk a lot about insights and analytics, which I fully appreciate. But how do you get over that resistance internally at the pharma company to even prove the value of insights? A lot of time they think of it as, this is a scorecard. You're just trying to tell me what I've done wrong.
They go right to the measurement tool.
Yeah, so how do you get over that resistance, especially at a more senior level?
So so that's a great question. So when I've seen people be most successful in those situations is when, if you're talking quantitative and qualitative, if you mix them, people get confused. Mm-hmm. If you keep it segmented, quantitatively, we're going to see this is what your market is going to do. This is where your market's going to be. This is what we're seeing happen in other markets. One thing is if you can use another market to say, listen, we took a look at 2 other markets to use this as a baseline for yours. We know you have your internal information, your follow, because we have this every year we do this and it's 5 years out. So we already know our numbers. So when someone comes in and tells us this is what your market is, we're like, we already know. We have like a 500-page deck that somebody did for us that has it there. So if you say, listen, based on what you have internally, we did a little external competitive intelligence to say, this is what's going to happen. That will really get their attention. Competitive intelligence is huge. This is what you say you're doing. I'm telling you this is what the people who are competing against you are going to do. You will be first in line because they'll say, bring them in, sit down, we'll give them whatever contract it is. You tell us what we need to know. We'll integrate you with our operations group. Tell us, because it's very expensive to pay for competitive intelligence, and a lot of it's BS, to be perfectly frank. Yeah. Honestly, it is. People come in to make stuff up. So if you can prove it and say these are the actual insights quantitatively and qualitatively, and this is how you might want to consider building your marketing plans. Right now we see, just for example, we see that your strategy, and I know I probably got to get off in a second, but we see your strategy and you've shared with us this is what you're going to do, right? This is how you're going to change behavior. You may want to tweak that based on what we're seeing with your competition, or hey, this then solidifies what you're doing because we're seeing it. So working with them as a partner, stakeholder, that's the key, competitively. You're welcome. Anybody else, or are we good for the next? All right, cool. Thank you guys very much.